morning. Welcome to Joy in Our Town. I'm your host, Lorene Tanaka. We are here this morning with Howard Garval, and he is the President and CEO of Child and Family Services. Thank you so much for being here.
Thank you.
Now, child abuse in Hawaii can be a subject that's hard to talk about, but it is a subject that we need to get information on, that we need to understand so that we can continue to help people. Tell us more about how Child and Family Services are addressing child abuse through Healthy Start.
Sure. Well, first of all, just a very quick sense of Child and Family Service. So we are one of Hawaii's largest private nonprofit organizations that deals with abuse and neglect. And we deal with serious life issues, but we believe we achieve life-changing results with a number of the people that we serve. And we are an organization that has a variety of programs, over 35 programs.
Wow.
From keiki to kupuna, so we serve the whole life cycle. My favorite expression now is twinkle to wrinkle.
Oh, I like that.
Yeah. But
it's easy to remember.
Yes, and it's cute. It's cute. So child abuse is a major priority for Child and Family Service. Our mission is strengthening families and fostering the healthy development of children. And you aren't going to have healthy development of children if there's child abuse or risk of child abuse going on. So we do a number of programs around child abuse, but I particularly wanted to focus on Healthy Start because we know from experience that we can prevent child abuse, and it's so much better when we can actually prevent child abuse versus have to intervene after the fact.
Fix something,
right? So one of our signature programs is Healthy Start. Healthy Start is a child abuse prevention home visiting program that is funded by the Hawaii State Department of Health. What's amazing is that Hawaii was the state that actually invented Healthy Start years ago in the 1980s.
Wonderful.
And it's now been replicated in close to 40 additional states under the name of Healthy Families America. So Hawaii really was very a pioneer.
Good job.
In really coming up with a program that was focused on child abuse prevention. And the beautiful thing about a program like Healthy Start is that we want to be able to intervene before there's ever a report of child abuse that would then go to the state child welfare services or child protective services. Some people think of it that way.
Is it one and the same?
Yes.
Okay.
And so basically in Healthy Start, what we do is we focus on parents of newborns, and we do assessments, we provide information. We can even do that through the program. There's a component called early identification, and that's where parents of newborns are actually offered services in the hospital once the child is born. So
this
from
is
the very beginning.
Every new parent.
Yes.
Okay.
And many parents really don't present risk factors for child abuse. And so what is typically done is that they're provided a variety of information about resources available to new parents. And anyone who's a new parent, especially if it's the first child,
you don't know what to expect.
Exactly, and they're nervous, and they're even if they've had very good parenting, they're still going to be nervous. And the first time, I remember I was a parent for the first time, very nervous, and
bubble wrap your child.
And I'm a master's in social work, and I think I understand what children need, but it's still kind of something that is just normal for parents to be nervous.
But that must also put them at ease to get this information up front.
That's right. So, and I think they're at a point where they're very open to any kind of help or services that could be provided. But what we do is we also go beyond that to do at least some degree of screening with parents of newborns. And when we, based on questions that are asked, when we determine that there are risk factors for child abuse. So those risk factors could be one of the parents was abused as a child,
Okay. Okay.
or there's domestic violence going on in the family. We're going to talk about domestic violence
right, in the
later.
second half, right.
Yeah. Or there's mental illness. Or even poverty could be a risk factor if they're living in unsafe housing or there's a lot of stress. And it's a combination. Substance abuse often could be a risk factor because in many families where there's substance abuse, and the State Child Welfare Services Division would tell you that a high percentage of the families they intervene with there's substance abuse going on, and that could lead to neglect and or abuse of children. So once that's determined, then the family, the newborn, the parents of the newborns are offered home visiting services.
Okay.
Emphasis, however, is that it's voluntary. You can't mandate services at this point to a family because they've not been reported to authorities or anything.
There's no reason.
Yeah, and so it has to be a voluntary kind of service. And that what we focus on with the parents of newborns is how do we help them build an environment of nurturing and care for their keiki, for their really young infant children.
And a lot of times here in Hawaii, though, we have extended families, so it may not just be the immediate family that you want to investigate or know about. You might be the other people that are living in the home as well.
That's exactly right. And sometimes we can identify a parent, another family member who has really has some real strengths and can really help to support these new parents.
Exactly.
Healthy Start, over the years, back to the 1980s, we have served quite a number of young teen parents, and they often are even at higher risk of child abuse because they are not mature yet. You know, sometimes we talk about babies having babies.
Well, or you know, you have a baby that is colicky or a baby that's jaundiced, and they're crying and crying. I mean, you know, who teaches us how to comfort that baby?
Yeah, exactly. And with a younger parent, they don't necessarily have the patience that when we mature as adults we have. And on top of that, of course, they don't have the experience, and often they don't even have the knowledge about what is normal for a child and healthy child development. So sometimes we're even able to screen parents prenatally, but if not, it's within the first 2 weeks of birth. And we use a standardized screening tool, and then we can refer the families to service providers in the community.
Good.
And by providing this kind of support at a stressful time in a young parent's life, we hopefully can reduce the impact of life stressors and parental stress, and also help the parents to increase their attentive and consistent care to the newborns.
So, but it's not just for first-time parents. It could be a parent that is having their third child or their fourth child as well.
Right. Yes, that's true. And in fact, we have seen in Healthy Start a number of parents who typically the program focuses with the parents from birth to 3, to the child turns 3. But we've seen a number of families where they felt so helped by the Healthy Start program that when they have a subsequent pregnancy and birth, they enroll again voluntarily in Healthy Start services, almost like a refresher to kind of get the support.
But this all is leading towards the whole prevention theme.
Right. That's right.
Wonderful.
Yeah. So we try to work with the parents to address their individual needs. Every family has to be looked at individually. Work with them to set goals. We come up with what's called an individual family service plan. And we also focus as well on connecting parents to services that are out in the community. A couple of key things that we want to ensure that the parents do is get connected to what's considered a medical home. So in other words, we want to be sure they get good pediatric care for their keiki. So for the early years, that is so important that they really make sure that they are connected to a
that's vital.
primary care physician, a medical home, that type of thing. The other thing we work with them on is getting immunizations, because those can ensure that the child is going to be healthy.
Healthy future.
Exactly, exactly. So those are things that don't even necessarily specifically relate to child abuse or child abuse prevention, but they're really important in ensuring a healthy child.
What are examples, when we use the term child abuse, and we have a couple minutes in this first half, what is an example of child abuse?
Okay. It could be severe hitting that leaves bruises.
Okay.
It can unfortunately go as far as broken bones. It can be, there is a concept called shaken baby syndrome, where the parent in fury, let's say you have a baby that's very colicky or cranky and just keeps crying, and out of frustration they shake the child. It can actually cause death. It can cause brain damage, and
because it will rupture their spine.
Because the infant, the developing brain is still not protected.
Well, and their neck isn't strong enough either, right?
That's right.
At an early stage.
Yeah, and that can be another form of abuse. Unfortunately, we've seen situations where parents throw a kid against the wall, where parents burn children with cigarettes. It's pretty gruesome at times what unfortunately some parents do to their children.
And you, as you mentioned earlier, it's not necessarily because they're bad people. It's stressors or other things that are coming into their life.
Yes.
Or
yes.
Is it also learned behavior?
Learned, exactly. So many, if you look at the prison population, such a high percentage of the prison population, if you go back to their histories, they were abused as children. So it really is a learned behavior. And that's the hopeful aspect of this, so that you do what you've seen, what you've learned, and so the focus with the new parents of the newborns is to teach. The primary worker in the program is a home visitor, and often that's a paraprofessional, but it's someone who is from that community, knows the community, and has experience with parenting, and their goal is to teach but also to model. So as the home visitor is in the home, and with the Healthy Start program, they start out bi-weekly